Thanks for being here. Good news, no new deaths over the last 24 hours, so very happy with that. 7-day average holding strong, 0.8%. That's important. I know sometimes we get focused on case days, but the more you test, you're going to find pockets of the virus or asymptomatic cases. And so our 7-day average has been in this range for, I think, 6 weeks. It's really, really very good stuff. Even within New York State, we're in a much, much better place than other regions. And so certainly positive news. 76 new cases today. We've had 32,609 cases. 70% of our cases are under the age of 40. So let's just use some common sense here. What does this mean? One, we know that 60 and above allowed to get the vaccine have been vaccinated. Many of those individuals twice. They've developed their immunity. They're doing much better. The 18 to 40 demographic, for most cases, not as readily vaccinated at this point. We'd like to change that. So we're seeing more cases there. There's more social gatherings going on in these age groups. Recently, Syracuse University's had some hiccups, as expected, as a college campus will. So that's just, kind of where it is, common sense. We need to watch out for these things. But the best thing that we could have happen, in my opinion, right now, and Dr. Gupta's here. I'm not a doctor, but I feel like I have a pretty good idea on my next life, what I want to be now. But let us vaccinate our community, and we'll end this quickly, because at this point you could even pivot vaccination strategies to where the cases are and where the higher risk is going to be. So you'll hear me talk about our ask of the state. Let us vaccinate our community. Eligibility needs to be expanded. At this point, just let us vaccinate anybody who's eligible to receive the vaccine. Hospital numbers, 40 individuals in the hospital, 13 in the ICU, so down 1 from yesterday, so that's good. On the vaccine, we have a new initiative today. We actually have a couple new initiatives, so let me get my notes here so I can read them better. We are going to develop, similar to OnList, on our website, a 50-year to 60-year wait list. So today, if you are that 50 to 60 years of age and you're not yet eligible, you can go on to ongov.net, put your information in. Why we want you to do that is in the event we have available vaccine that we need to use, we will pull from this list and get you in for those appointments. Very similar to OnList. So please go to ongov.net. There's a button there to sign up. And so we want to do that so that we have a waiting list. So right away with this group, if for some reason they become eligible next week anyways, we'll just send out an email and offer you appointments right away. But if we have a day where midday we're seeing no shows and we know we have the next day has appointments available or whatnot, we'll reach out to this list. Second piece of news on the vaccine, next week, Monday and Tuesday, the vaccination clinics will be at Shoppingtown Mall. We'll be doing a drive-through testing site at Shoppingtown Mall. This will be the 22nd and the 23rd. It's a good opportunity. They've done these drive-throughs in Oneida County and in other counties. Some people are intimidated to come into whether it's the Expo Center at the fairgrounds or the On Center, and this allows you to go to Shoppingtown, which is probably potentially closer to your home. You drive up, get your shot, turn in your paperwork, go wait your 15 minutes in your own car, and then you're done. Those links to register for the drive-through Shoppingtown site are opening today at 4 o'clock. So I think it's 3 now. So in the next hour, those appointments will be available. So please take advantage of it. We have had people ask us about it. We're listening. We're doing it. Homebound residents, via our efforts and our phone banks, we received an additional 350 seniors that we will now work with Essentia Health to get vaccinated. Thank you to everybody who called in on behalf of a loved one or a neighbor. The phone calls have essentially stopped the last day. We haven't gotten any more. So what we're going to do is we're not going to pay people to sit there and not answer the phone. We will, if you have a loved one that is still homebound and you want to have them vaccinated, email us at covidvaccinations@ongov.net, and we can do the same thing, and we'll go out and get them vaccinated. Or if you call my office, we'll take on the information and get it done as well. But at this point, it was effective. We've 350 residents that we've identified in the community that need their shot, that don't have the ability to get transportation or are just at a point where they can't get to one of the clinics. So that's good. And I want to thank Essentia Health, obviously, for their partnership with this. Symptomatic testing, as a reminder, any symptoms, you need to get a test. And if you have symptoms, you need to get a PCR test. Register ongov.net/Cayuga Medical, Monday through Friday, 9 to 1. Then on weekends, at Upstate at Community Hospital. Looking at asymptomatic testing, we still have our community sites that we have every day. I think today we're at the town of Onondaga. Tomorrow we're at the Lafayette Community Center and the Clay Senior Center. Go to ongov.net and register for a asymptomatic rapid test. Another tool that we have. Couple other bullets. Dr. Gupta is going to be posting school guidance related to some of the changes that she's been working on with her team. I want to thank Dr. Gupta and all of her team for taking a leadership role in this process. Sometimes in this pandemic, people get stuck in neutral, and you need to rebalance, and you need to lead. And when you lead, sometimes people are critical. But I want to thank Dr. Gupta for taking that task on to help give us the information we needed to give good policy. She, in addition to the guidance we've talked about from 6 feet to 3 feet, in Dr. Gupta's guidance, it talks about busing policies and ways kids could potentially be within 6 feet for a period of time on buses. And then giving guidance to districts. It also talks about the music issue of music class. In the guidance, again, Dr. Gupta gives what recommendations the CDC and the state gives, and leaves it up to school districts to decide which protocols they're more comfortable with. But the good news is the CDC's at 6 feet for music class. We've seen that before. And so with the 6 feet with music class, that will allow some of these classes to get going under certain guidance if the districts choose. Again, everything we do is give guidance based off of the transmission levels and the risk in our community. And certainly the districts will have the final say on that. Landlord assistance, part of 2 stimulus packages now, has provided landlord and tenant assistance to help tenants who have not been able to pay rent related to the pandemic. We have received $13 million to date. I think we'll receive another $10 million for this, and we'll partner with the city of Syracuse as well with some of their efforts. We're going to put out the applications in early April, but essentially a couple generic bullets. There will be up to $5,000 per unit for back rent. Will be allowed for the application for the tenant to fill out, or the landlord can fill it out with the tenant's permission. But as part of that, the landlord will agree that there will be a 3-month moratorium on evictions. So you can get up to $5,000 per unit in back rent, but you're agreeing for the next essentially 3 months there will be no evictions moving forward. As part of it, it will be a web-based application, and again, we will have that up early April, and we'll start getting the money out the door. Part of this is we have to staff up for this effort, and so we're going through that process right now. Before I take questions, usually we have our Nepalese interpreter up here with us, Manu. Manu, for those of you who may have noticed over the past few months, was pregnant. And Manu had a beautiful baby, Suman. And this baby is so cute. If Manu lets me show pictures of the baby at the next briefing, I will, because every baby's cute, but this baby is really cute. So we're very happy for Manu and her family, and we can't wait to meet our new friend, Suman. So saying that, happy to take questions.
Ryan, is the town planning to take any actions related to the Skyline apartment?
Yeah. Yeah, so here's the process, Tim, how this works. We start various health department investigations into this once we're alerted by the codes department. We were alerted in February that there was an issue. We went out and cited the facility. We found human excrements on stairs and the landings and all the stairways in the apartment complex. Accumulations of garbage everywhere. The facility was in very bad shape. We then cite them with our health code. We went back out actually this week on Monday, and we checked in on it. Improvements were made, still not completely made. Unfortunately, the horrific situation has unfolded since then. And our health department will be back out there again, I believe, next week to look at where it is. Certainly, we support the mayor in his efforts to deal with this situation. There's options on the table. They're looking at their options. From February to March, they did make small progress related to the health-specific conditions, but this property has other problems besides the health-related conditions.
With the Skyline Apartments, Ryan, with Shoppingtown Mall, it was sometimes hard to find the owner, right? With Skyline Apartments, it's Tim Green. People know where he lives in Skinny Atlas. So to think of such a respected community member and whatever management group is running this be responsible for something like this, how do you swallow that as a community leader?
Well, look at we get involved when someone tells us we think there's a health problem. We don't have a codes department. So we've been involved with this since February. Things have deteriorated very fast as far as the safety of the tenants. I've followed some of the back and forth in the newspaper related to what the management company is saying. Could the eviction moratorium be playing a role? Potentially, but then they would have filed for evictions for these bad actors in the building. And I don't know if they have, right? There should be a paper trail if that's actually what happened. So again, this has been deteriorating for a period of time. We're involved on the health side. We would be involved, obviously, on if we had to find housing assignments for tenants. That would fall onto us as well. So we'll work with the city closely. But certainly the management group, which is all locally owned, to your point, certainly needs to be good partners here. I get you're trying to sell the property, but now we need partnership to solve these problems.
Ryan, are any of the tenants in the apartment complex county funded?
Yes.
Does that give you any more leverage?
If the funding by law, we can cut off the funding. Now, look, I could cut off the funding anytime I want, I guess, and get sued. But our law department has. There's at certain points we can cut off housing assistance, and the property would have to be condemned for us to do that.
The property has to be condemned.
Correct.
As for habitation.
Correct.
And that determination has not been made.
Not yet.
Is it unusual for the health department to be called in for this kind of inspection?
I would say this is probably not on a daily routine for the health department. Certainly, the health department does lots of inspections related to restaurants and other properties, but certainly to get called in to review what were certainly unsanitary conditions in hallways and whatnot, that's not what our inspectors are doing every day.
Do you know how many of the tenants are county funded?
I don't. I know it's a large chunk of monthly payments that are made from the county there. Again, I don't know if it's $40,000 a month or $50,000. We can get you that information.
On the pandemic, the governor today announced some restriction changes, concerts and sports venues. The county has a stake in two of those areas, the amphitheater and NBT Bank Stadium. Wondering if you have any further clarification. Testing and vaccinations were a requirement for sports, but it wasn't mentioned when it comes to outdoor venues. Do you know if testing and vaccinations will be required at the amphitheater?
We haven't seen any. My understanding was it's either or, which it makes more sense. I think just from the standpoint of the public, this vaccine has a lot of value. If we believe it has value, certainly then it should be safe to do some normal activities after you have your second shot and have immunity, right? I believe it's an either or. I do believe that eventually by the time concerts, there's rules and then there's the reality of the industry and will things happen based off of the rules. You will not have a concert season at 20% capacity. Okay, I can tell you that. By May, June, at the rates we're going, our community will be vaccinated, hopefully. So there will be no reason not to have higher capacity at that point, and then you could have a concert season. But at 20% or 10%, some of these rules that they're coming up with, I appreciate trying to figure out a way to turn on the valve, as they say. But again, it's very difficult. We've never been here, so I have to tell myself that at these times. But when you're making macro level decisions, when a virus is impacting regions differently, it's very difficult to do that at the macro level in an equitable way. And so I think that's kind of where we find ourselves now with all these rules. We are at a sustained low transmission rate. Sustained low transmission rate as we take in higher education cases. Yet we are under the same rules in the Hudson Valley, where the positive rate's at 5, Long Island's at 5, New York City's at 5, maybe even going higher. That makes no sense. And so that's my whole point of the state needs to pivot back to making regional decisions, or they need to let county executives do the jobs that we're elected to do. That would be nice.
The governor, though, if you look at his slides closely, on the athletic component, the sports venues, it mentioned testing and vaccines. On the concert slide, it didn't mention that at all. I'm wondering if it's a 20% opening for anyone.
It could be outdoor venues too, Andrew. I haven't seen it. I had an appointment when he was on. I know 20% for the amphitheater. I know the ballpark's 20% too. So it could be for outdoor venues are different than indoor venues. That would make sense, right? So at least right now it makes sense. Once everybody's been vaccinated, I would question whether that makes sense.
Jason Smorrell sounds like he's planning to have fans at 20% capacity at the ballpark. Well, it might not be enough for an amphitheater concert. It sounds like he's planning on doing it for a baseball game. Would the county be willing to step in to offer the rapid antigen testing to help people be eligible to buy a ticket?
Yeah, I think people can. We have testing in the community every day. People can utilize that testing infrastructure every day. So will we do things special for one team or not? I don't know if we would do that. Certainly, we own the ballpark. We want people in the ballpark, and we want a season desperately. We just invested $25 million in the ballpark, and it's going to be fantastic. I think the community forgets about that. During this pandemic, we've been doing a $25 million renovation of that stadium, and it will be soon in a couple weeks. It will be ready in a couple weeks. So everybody should be really excited to get out to the ballpark with your families. We'll see how it all lines up with that. Again, if it's vaccination or testing, we have 140,000 residents who've been vaccinated going into today. By the time May comes around, we could have another 60, 70,000, even more people vaccinated by then. So I think things will be different as we get into May.
There are concerts scheduled at the amphitheater. You don't see those happening if only 20% capacity is allowed?
I doubt it. I doubt it. Again, there's no way. There's no way you can keep that rule there when your vaccination rates go up and transmission rates go down. These are rules for today. If we wanted to go have a concert today, which we could, if the weather permitted, that would be the rules. I think the rules will have to loosen up practically to have some of these venues open.
There's been reports that 80% of New Yorkers are vaccine eligible. Do you think that's an accurate number, and do you think that's reflected in Onondaga County?
I don't think that's an accurate number. Let me say this. So I believe most people, probably qualify under the BMI, which is what Dr. Gupta, the body mass index. Is that what am I right there? So most people, I think, qualify for that. So if you want to look into the BMI, if you're 16 and above for the Pfizer, please look into that. And if you think you qualify, please come get your shot. But I don't, from the eligibility categories, there's no way 80% qualify. That would be the only way, is the BMI that people would qualify. We're having trouble filling the slots under the current eligibility, and we're not alone. Every county across the state's having the same problem. So in the state fairgrounds has the same problem. So we really need to open this up to everybody, or we need everybody to look at their own BMI over the next few days and get registered and get your shot.
And you talked about the hiccups at SU. Do you support those younger adults getting vaccinated, and do you want them to get vaccinated since they are the ones spreading it mostly?
I do. I think if supply increases, part of our strategy will be to target those campuses specifically as well. I think if we can develop immunity on those campuses, we will quickly start to see these numbers drop even further.
And are the school barriers still expected to be delivered by April 1st?
I think some of them are already here. Yeah.
Just another question on Skyline. You
Mhm.
mentioned some of the formal actions that the health department has taken. Just informally, have you had any discussions with the Greens or with management about trying to bring that facility in line?
I haven't. I talked to the mayor yesterday, and I told the mayor he has my full support, whatever direction he goes in. And again, if it's a direction where, I think he's talked about receivership, condemnation. Condemnation, we need to get the residents out of the building at that point. And again, certainly that would then turn over to our economic security team and work to find housing for everybody.
You gave some big vaccine announcements today. I'm interested. You said that people are requesting and you're listening in terms of drive-through options. I'm just curious, would you reiterate? Some people say, I'm not in the mood to go into a big building.
Yeah.
I want someone to come to me at my car window.
Yeah, I think we need, when you get vaccine, and there's a lot of competition, and essentially the eligibility rules aren't catching up to the competition, you need to be very customer friendly. So we're being very customer friendly right now in hopes everybody wants to come to the Shopping Town drive-through site on Monday and Tuesday, make history, the first drive-through vaccination site in Onondaga County history. And then, again, we're going to do our 50-plus waiting list. And then if we have appointments that, because we have vaccine that doesn't get filled that day, then we're going to reach out to these people and have them fill in those appointments.
Drive-through is Monday and Tuesday.
Yes.
Appointments go up at 4 o'clock tonight,
Yes.
this afternoon. Whatever.
Get your appointment for the first ever drive-through.
How many are there?
The two clinics will be Monday and Tuesday. If they're successful, we may keep going that route for a little.
How many slots are there?
Oh, Dr. Gupta, what are we thinking? 12? Yeah, 1,200 per day, yeah.
Do you know if New York State will open up vaccines to all remaining essential employees before opening it up to everyone?
I don't know what they're going to do. We've asked them to specifically lower the age, add different industry, and now I think we're at the point where there's if you look at each part of the state, and I understand, again, I understand that when you open up the category of public-facing employee in New York City, you're talking about hundreds of thousands of people. And so maybe you need a little time to get through that. In Onondaga County, you're talking about a day's worth of vaccinating between the fairgrounds and the on-center. So the new eligibility groups that got opened, we're almost done with. And it's Thursday, and vaccine week's Wednesday to Wednesday. So we have all this other supply, and we're trying to really micro-target and make it as easy as possible for people to get their shot now. So that's the challenge. So again, what would be nice would be if the state said, county executives or county leaders, you can now, and they did this a couple times, counties have the choices to open up for restaurants or hotel workers. And what we do then is based off of the demand for our slots, when the demand's low, we open up those categories. So if the governor said counties have the ability to vaccinate anybody over 16 for the Pfizer shot, we would then not just create chaos, we would manage it, and then based off of the demand, we would then open up more. But the demand's different in each community. It's not the same throughout New York State. And so, again, that's why traditionally counties run these vaccination processes. We've benefited by having the fairgrounds here because of the supply that's gone through here, and our pod as well. So we've benefited for supply. But at this point in the game, it's pretty hard to do our job when everybody's gotten a shot in these groups for the most part.
So if it were up to you, you'd open it to everybody tomorrow?
Yeah, I think so. The fairgrounds has slots. We got slots. We know we're going to get another good chunk of vaccine next week. We know they're going to get more vaccine. The pharmacies are doing pop-ups for 50 or 100 shots, right? Everybody's got supply. Let's just shoot up some arms. Let's end this thing.
Do you have a pick for tomorrow?
Cuse is going to win. We got a nice bracket, Andrew, and the West Virginia could be a second-round game. We know Coach Huggins, the Huggy Bear. Some people call him the Huggy Bear. And we're going to have a nice matchup there. And then I think you could see Rutgers then, who we played earlier this year, but without Buddy Boeheim. So could be a nice little run here. If my bracket serves us well, we'll get to the Elite Eight and we'll play the Fighting Illini, who sent us home in 1989. So we'll have a chance to avenge that much later on in my life. So I'm very excited about March Madness. And we're still asking the state. The state's creating a problem for us with this curfew. The idea that people are going to be potentially in a restaurant, the game's going to start at 10, maybe even start after that, depending on what happens before, and people are just going to leave right at 11 is not practical. It's creating problems for us, for enforcement. So it's going to create our enforcement unit to have to go out later in the night, because I'm not going to go dragging people out of establishments during the SU game. So the state really needs to work with us on this. We've asked them to. We haven't heard back. The governor mentioned yesterday he's not going to look at it statewide, but I don't know, maybe they'll change their mind. But it's not practical for us to be out dragging people out of establishments at 11 o'clock in the first half of the SU game. Anything else?
It took you a whole year to keep your briefings to 30 minutes.
Wow, we're getting good at it. Thanks, everybody.